Forum. My name is Jeff Upton, and I am the chair of the Crime Prevention Council for the City of Thunder Bay. I'm also the chair of the Community Safety and Wellbeing Planning Committee as well. And I'm joined tonight by my colleague, Leanne Chevrette.
Hi, thanks, Jeff. Hi, everyone. Really pleased that you are sharing some time with us this evening. My name is Leanne Chevrette, and I'm the coordinator for the Thunder Bay Crime Prevention Council. Jeff's going to talk just a little bit in a moment or so about the Crime Prevention Council, but just a little more about me. I've been the coordinator for the last 7 years now. I've been living in Thunder Bay for just over 11 years now, but I'm from Northeastern Ontario, from Timmins originally. So Jeff, I'll send it back over to you and we'll get started.
Great, thanks very much, Leanne. So once again, everyone, thanks for joining us tonight. We really appreciate you taking the time for something that we strongly believe is really important to our community. We're looking forward to giving you an update on this community and safety and well-being planning process, where we're at, and we're going to walk you through that tonight. Before we begin, though, I'd like to acknowledge that we are on the traditional lands of the Anishinaabe people of Fort William First Nation, signatory to the Robinson Superior Treaty of 1850. The footsteps of their ancestors have walked these lands for millennia, and we are grateful for their stewardship of these beautiful lands and waters. We also acknowledge the contributions of the Métis people to this region. We recognize that the land acknowledgement is only one small step towards reconciliation, and more must be done to address the harms that have been caused by colonialism, oppression, and racism. May we strive for respectful relationships as we search for collective healing and true reconciliation and honor this beautiful land together. Next slide. So we'll start tonight. Here's an overview, ladies and gentlemen, of where we will begin. We're going to start with an overview of the community safety and well-being planning process. We're going to talk about the planning framework and the deadline. We're going to do a review of phase 1 community engagement process, what we have done so far and what has brought us to this place tonight. We will talk about the 6 local priorities that have been identified through the phase 1 community engagement process. And then we'll talk about phase 2, the community engagement moving forward and the next steps of the planning process. Next, please. Just a little bit of information about the Crime Prevention Council if you're not familiar with us. In accordance with the direction of the Thunder Bay City Council, the Crime Prevention Council is tasked with the coordinating and development of a community safety and well-being plan for our municipality. This is required under provincial legislation. A little bit of information about the Crime Prevention Council is that we are an advisory council to City Council. We are comprised of 45 members representing diverse sectors across the community. These organizations and individuals collaborate on the implementation of our strategic plan, which aims to reduce the risk factors associated with crime and victimization in Thunder Bay. And we plan on and hope to strengthen the protective factors to end crime and victimization. Next, please. Our vision of the Crime Prevention Council, the vision of the Crime Prevention Council is that Thunder Bay is a safe and inclusive and welcoming community. And our mission statement identifies that we are enhancing the safety and well-being of everyone in Thunder Bay by engaging the community and advancing ideas and actions that reduce crime, social disorder, victimization, and fear of crime. Next page. So here is some background information for you on the community safety and well-being planning process. On January the 1st, 2019, the provincial government set new legislation that mandated all municipalities to prepare and adopt a community safety and well-being plan. The overarching goal of the plans were to proactively address locally identified priority risks to community safety and well-being. There were additional requirements that were outlined in the legislation that the municipalities would look at. These pertain to conducting consultations, the contents of what would go into the plan, monitoring of the plan, evaluating the plan, reporting, and publications of the plan. The ministry's original deadline, the government's original deadline for completing the plan was January the 1st, 2021. However, this deadline was delayed by the government due to COVID and now was set as July the 1st, 2021. The government provided a provincial planning framework, which was to guide our process. And at this point in time, I'll invite Leanne to talk about what that framework is.
Thank you very much, Jeff. Next slide, please, Carrie. Thank you. So as Jeff has shared, the province has developed a provincial framework to guide municipalities in their development of community safety and wellbeing plans, which encourage a deeper understanding of 4 planning areas to ensure that all local plans are efficient and effective in making communities safer and healthier. So these four areas include social development, prevention, risk intervention, and incident response. And I'll go over each of these very briefly in the next few slides. And I think it's important just for the community to understand these different levels of prevention that we're trying to achieve through the plan. Next slide, please. So the first planning area is incident response. And this refers to both critical and non-critical incidents requiring an emergency response, such as police, fire, or EMS. And we know that often police are the primary response mobilized, and increasingly they are being called upon to respond to situations that really lie outside of their core mandate, like social and health issues, mental health, substance misuse. So they're responding to a lot of social and health issues. Ultimately, as a community, we want to be more proactive and less reactive. And this means preventing situations from escalating to the point where an emergency response is actually required. And of course, we recognize that we still need these emergency services, but we're just hoping to help reduce pressure on these systems where possible and mobilize other interventions that are perhaps more appropriate for the situation at hand. So Carrie, if you could advance the slide, please. Thank you. And I want you to keep an eye as we move through these slides on the size of the red circle in the center and that emergency response or critical incident response. So the second level of planning is the risk intervention level. So in this level, we are working to mobilize and create different initiatives that reduce harm before a critical or non-critical response is required. So for example, in Thunder Bay, we have established a situation table where individuals can be referred if they meet a threshold for what we call acutely elevated risk of harm. And this means that if there's no intervention within the next 24 to 48 hours, it's very likely that significant harm to self or others will occur. So this is the planning level where collaboration is required between acute care agencies to mobilize interventions and mitigate risks in our community. So having successful programs at this level will help to reduce the number of incidents that require a critical response. Next slide, please. So the third planning level is the prevention level. And in this level, we are working to proactively identify and address local risk factors before they escalate. Again, we're trying to sort of put measures in place in our community to reduce the need for that emergency response. So examples of planning this level include such things like, and these are just a few examples, youth programming, parenting programming, gang intervention programs, those sorts of things. So here we're really working at identifying risks and implementing programs that we know are evidence-based and can address those risk factors and build more protective factors in our community. Carrie, I'm getting some feedback. I wonder if you could mute. the other participants, please. Thank you very much. Awesome. Okay, carrying on to the next slide, please. The next one is, let me just get myself in the right place. Sorry. The next one is social development. So this is the area where we hope to have, or we encourage long-term upstream investments to improve social determinants of health, such as housing, poverty, food security, those basic needs. And this is where we can also address complex social issues such as systemic racism, structural inequities, health inequities, poverty, access to education. This is where we believe big change needs to happen in order to impact the other 3 levels of planning. And so if you can imagine for a moment, if everyone in our community had access to safe, affordable housing, was not living in poverty, experienced health equity and access to other services that they might need, we would really be able to prevent a lot of situations that are happening in our community and keep people safe and well. So this would help to make our community less reactive and far more proactive. So these are the 4 levels that I'm mentioning here tonight. These are the 4 levels of planning that the provincial framework is asking us to work within. Next slide, please, Carrie. Thank you. So there are a number of critical success factors that we need to be conscious of as we go through this planning process. And so I'm just going to go through these fairly quickly, but I do think that they're really important. First of all, we need to use a strengths-based and risk-focused approach when we're talking about designing programs or implementing different programs and services in our community. We really need to increase awareness and understanding in the community about the benefits of community safety and well-being planning and the role that everyone plays within in our community. So whether it's at the individual level or the family level, neighborhood, within schools, in our workplaces, in the broader community, we all have a really important role to play when it comes to community safety and well-being. We need the highest level commitment and buy-in from decision makers. And given that this is being coordinated by the city, we have on the steering committee a city council member, and we have a lot of senior level representation from a number of different organizations on our steering committee. Sorry. So we also need to use research and data to inform our decision-making and our planning process. And of course, we need to be culturally responsive. So we need to make sure that we're responding to the needs of diverse groups in our community. Next slide, please, Carrie. So this is another sort of snapshot of the planning framework. So the first step in the top left corner is to identify priorities. And in a couple of minutes, Jeff will sort of bring us up to date in terms of where we have come through the process of the phase 1 community engagement process and where we're heading. So we have identified the priorities, and we'll talk more about that in a couple of moments. And so the next steps are really to determine the outcomes that we want to see for each of those priority areas, and then select programs and strategies that we will collectively implement as a community to achieve those outcomes. And then, once we're into an implementation phase, we want to continually review the plan and update the plan. And as we move through this process, again, we'll go back to identifying perhaps additional priorities that we need to focus on as a community. And so the cycle continues. So I will pass that back to you, Jeff. Thanks, and thanks, Carrie, and you can go to the next slide. Thank you.
Thanks, Leanne. At this time, folks, I'd like to take us through just a quick review of what we've accomplished so far. So if I take you back to January of 2019, the new legislation mandating the municipalities to create a plan occurred. On March the 20th of 2019, City Council appointed the Crime Prevention Council as the advisory committee for the development and implementation of this plan. August and September, the steering committees and working groups were established. And in that fall, the planning for phase one community engagement began, and the process for that planning, and as well as looking at community level data assessment, also began by our subcommittees. This time last year, in January to March, we began our phase one community engagement implementations. And that seems so long ago at times that it was just last year at this time. And I'll break down for you in just a minute the phase one engagements that we were able to complete. And then, as you all know, the COVID-19 became a factor and an issue in our communities. And so some of our work after March became on hold. And behind the scenes, our committee members continued to talk, but we did not have really any official meetings until the fall again. When the fall came, we began to look at the data that we got from the engagement sessions that you're going to be introduced to in just a little bit. We began our work on the engagement reports and our local data reports as well. Bring us to now, 2021. We are in the planning phase two process, planning for our community engagement of phase two. And in March, we are now beginning our phase two community engagement implementations. So back last year at this time, we did begin our community engagement. We utilized 4 engagement methods. We did public forums, we did focus groups, we did online community surveys, and we did community conversations. And we did that over a 3-month period. Our engagement reach, we had 216 people complete the online survey. 108 people actually completed it online, and 108 people chose to utilize a paper copy and submit that to us. We had 563 people participate in 25 focus groups, public forums, or community conversations. A total of 779 people were engaged in this phase, and they were either engaged in the phase by their choice of coming out to us on their own to one of the events, such as this one tonight, or they chose to get involved with one of our community conversations or forums that was more of a smaller focus group as well. Our engagement reach, in terms of the engagement, we reached out to diverse groups. We wanted to make sure that we were getting as much of a representation across the community as possible. So we reached out to and spoke with youth and seniors, Indigenous community groups, other equity-seeking groups. We reached out to people with lived experiences and people with living experiences. We talked to service providers. We talked to newcomers to Thunder Bay. We talked to faith groups and a number of other groups that were part of our focus groups as well. When we met, participants were asked questions to identify their greatest concerns and their priorities that were related to community safety and well-being. I'll turn it over to Leanne.
Thank you very much, Jeff. So through that first phase of community engagement, as Jeff mentioned, we asked a number of questions, and through that, we were able to gather feedback and analyze that. And what we saw was that 6 clear priorities were identified through that process and that data capture. And they're listed here. They're not in any order of priority. All 6 are listed, but I'll go through them. So the first was racism and discrimination, housing, poverty reduction and financial empowerment, Number 4 is mental well-being. And by mental well-being, we mean this to include mental health, substance use, stigma, and social isolation. Number 5 is community violence with a focus on gender-based violence. And number 6 is supports for children, youth, and families. And I will say that, so while these were identified in the community engagement process, we also at the same time had another working group working, it was the data working group, and they were pulling together data sets and indicators from across the community around crime and victimization, housing, like homelessness, the proportion of people living in poverty, and other social determinants of health, how many people, or the proportion of people in our community who experience food insecurity. And so we looked at about 50 different data sets across the community. And definitely what that group identified as a priority, as priorities as well, matched very well with this. And so it's actually really good to see that, both, so, well, good to see in the sense that the two data sets merge and support one another. So we want to make sure that the data in our community supports this, but also that the community has selected and identified these priorities because they are the ones experiencing these and have firsthand experience of what is happening in the community. So we were happy to see a very clear identification of those 6 priority areas. Next slide, please. So during the consultation process, phase 1, we also asked participants to share with us what they believed were the root causes of the greatest community safety and well-being concerns. And this slide and the next lists the top 10 root causes. And just quickly, I'll go through these. So poverty was identified, and the fact that people just aren't able to meet their basic needs. Growing mental health and addiction issues were identified as a root cause. Inadequate social health and treatment services in some of the northern communities, and the local systems are not set up to meet those demands. Colonialism, racism, and structural violence. So there were a lot of conversations about this and barriers as a result of these experiences in our community. Lack of education and awareness. Next slide, please. Thank you. A lack of opportunities for youth. A trauma, including intergenerational trauma and adverse childhood experiences, or ACEs. Some of you on the call may be familiar with that term. Barriers to education, barriers to services, so inaccessible or inadequate for demand. And that kind of ties back into the previous slide where we mentioned that again. And lack of resources, funding, and investments. So these are the top 10 root causes that are believed to sort of underlie or be behind the key challenges and priorities that have been identified by the community. Next slide, please. Thank you, Carrie. So we also asked questions around of our participants, which groups they felt were made most vulnerable in Thunder Bay. And so the top 10 groups are listed here. So number 1, people who are homeless, people living with untreated mental health conditions, people with problematic substance misuse conditions, Indigenous people, especially Indigenous women, newcomers, seniors, the 2S LGBTIQ+ community, children and youth, the disabled community, and people in conflict with the law. So we had a lot of conversations at our sessions, and there may be some of you on the call who participated. I believe I saw some names there that I know were at some of those sessions. And so the way that the plan will develop, and we'll talk a little bit more about that in a few minutes, but The idea is to identify first the key risks in communities and municipalities across the province, and then identify who's most at risk or who's most vulnerable for experiencing those risks. And then the next stage is to mobilize those interventions. And as we discussed as I shared in that slide with the 4 green squares. So this is a really important part of the process as well, is really identifying the root causes and also those who are made most vulnerable in our community. And Jeff, I'll turn that back to you. Carrie, if you could advance, thank you.
Thanks, Leanne. So at this point, we are today moving into our phase 2 of our community engagement process. And again, we plan to utilize 4 various elements: community information sessions, such as this one, which is live right now online as best as we can under the virtual conditions that we're working in. We are recording the session, as you know, as well, and we'll post that to the city's website and other places so that those that couldn't join us tonight are able to get this background information as we move forward. We have scheduled 6 engagement sessions, and there is a poster that's around, and I have the dates on the next slide, so I will point those out to you in just a minute. We have a 24/7 available online forum again. This is on the City of Thunder Bay's Get Involved public engagement platform, where we will be encouraging people over the next 3 weeks until Friday, March the 26th, for members of the public to answer questions and provide input on the 6 priority areas. We've also, again, created a community conversation facilitators guide, which we utilized in phase 1. And this is available for anyone who wishes to hold their own mini consultation with members of their own families or their own social circles or groups that you may be involved in, to increase our outreach into the community. And we encourage you to do this in a safe manner, following all COVID-19 safety protocols. And we do encourage virtual sessions at this time. Next slide, please. So our 6 upcoming virtual forums: on March the 9th, we will focus on housing. March the 10th, racism and discrimination. March the 11th, mental well-being. March the 16th will be the virtual forum on community violence with a focus on gender-based violence. March the 17th will be poverty reduction and financial empowerment. And March the 18th will be on our 6th area, which is supports for children, youth, and families. Once again, everyone will need to register for these sessions, just as you did for tonight's live virtual session. You'll get a Zoom link prior to the session, and our colleague Carrie is again handling all the coordination of these sessions, including the registrations. And we thank Carrie for all her behind the scenes work to bring these sessions to our Thunder Bay community. Next, please. And at this time, I would like to take a moment to thank the members of the steering committee who are helping to guide this process. These organizations are on the screen in front of you, and I'd like to take a moment and read their names to you, because they have provided much time over the since January of 2019 into bringing us to this place of where we're at today. So I'd like to thank Fort William First Nation, Anishinaabe Aski Nation, Thunder Bay Police, Thunder Bay Police Services Board, the Thunder Bay Drug Strategy, Children's Center Thunder Bay, Delikal Anishinaabeg Family Care, Canadian Mental Health Association, the Thunder Bay District Health Unit, Lakehead Public Schools, the District of Thunder Bay Social Services Administration Board, Thunder Bay Multicultural Association, St. Joseph's Care Group, Superior North Emergency Medical Services, and the United Way of Thunder Bay.
Thanks, Jeff. Back to me. I'd also like to thank the members of the Crime Prevention Council who are overseeing this planning process, and many of whom are participating in both the working groups and some on the steering committee. You know, it's just after 7 now. I knew that we wouldn't take an hour and a half to get through this presentation, and we wanted to save some time for questions. So that's all we have for the presentation. Carrie, if you can just put the last slide up. If anyone needs or would like to get in touch with me and has, we'll have a question period in a moment, but if anyone should additionally wish to get in touch with me, here's my contact information. For any information about the community safety and wellbeing planning process, or registrations, background documents, you can find all of that at thunderbay.ca/CSWB. So I encourage you to go there. So that's all we have set up for the presentation. And then I'd like to turn it back over to Carrie to facilitate a question and answer session or opportunity for us. And yeah, we'll do that.
All right. So if you'd like to ask a question, you can put your hand up by going to the reaction button on the bottom of your screen, and you can choose a thumbs up if you want, and I can come and see. I can undo your video camera if you'd like, or you can also place your question in the chat if there are any questions.
Sorry, maybe I can just ask a question. Are there some individuals on the call who have already registered for the upcoming sessions over the next 2 weeks?
I can tell you the answer to that is yes. There's a number of people that have registered for a number of the sessions that are on the line tonight.
That's great.
Yeah.
That's great. Wonderful. Can I ask the question if folks participated in the previous engagement process?
So if you'd like to answer, you can put a thumbs up or do a clap hands with the reaction on the bottom of your screen if you participated in the previous engagement process. So Rebecca Johnson has, Darlene has.
Great.
Excellent. So we do have a question here.
Yeah.
There's Kevin has said, I like that root causes were identified, but there are not any discussions about root causes on your schedule. How can we get at the root causes?
So Kevin, thank you for the question. It's a really important question. And where we want to get at the root causes is really in the social development sort of layer of that framework. And so those are challenging, right? Those are the systemic sort of issues. We're talking about systemic racism. We're talking about health inequity, those types of things. People living in poverty, for example, not being able to access their basic needs, not being able to access healthcare. And so there are a lot of tables, including ours, that are really pushing to change systems and to address those inequities. We at the Crime Prevention Council and also many other tables that we sit at, there are really lots of really big conversations happening around upstream investments and really pushing for change, I guess I will say, so that systems are made more equitable and people have access, equitable access. These are big conversations that are going to take some time for sure, but we recognize that until we have health equity, until we really address racism and systemic racism and other impacts of colonization, for example, is going to be challenging to to make a really big change in our community. And I think, you know, when we look at the impacts, for example, of COVID-19, I think COVID-19 has made very visible a lot of the gaps and inequities that many of us have known have existed for a long, long time. But I will tell you that this has brought people together in a way that I have not ever seen before, and really mobilized supports for people in a way that I have not seen before. And so I know that we can do it. And I know that as a result of COVID-19, we will see a lot of policy change, or that's at least what I'm hoping for. So it is a big question. And you're right, we're not focusing specifically on root causes at a particular session, but we can certainly discuss those root causes within each of those sessions.
I was just going to add, Leanne, absolutely. I think, Kevin, and thank you for your question as well. I do believe that within the priority sessions that we're going to have, I think the root causes are going to be foundational to a lot of our dialogue over those nights.
Yeah, I agree. Thanks, Jeff.
Okay, thanks, Jeff and Leanne. The next question is, has the Ontario government suggested that there will be funding if suggested?
So this is also a great question. The province has made clear that they're not going to be providing any additional funding at this point. That's what they have said for the last several years. I've been in this role since 2014. And at that time, they were just in discussions about developing this framework and moving towards a community safety and well-being planning process for municipalities, excuse me. And so we've been pushing for funding, for the province to provide some funding. The way currently they provide funding and what they have said they will continue to do is through various granting programs. And so they have like Proceeds of Crime granting fund. They have a Safe and Vital Communities a funding opportunity, but that sort of pits different municipalities against each other to compete for a pot of money. So, you know, some municipalities will be successful and others will not be successful. So we need to try to mobilize our community from within and to sort of leverage existing resources and do our best to increase efficiencies. And yeah, that's at this point, that's how we have to do this. This work is all being funded through the city, and no municipalities have received additional funding to do this work. So it is a bit of a challenge, but it's a really critical process, I believe, for all municipalities to go through. So we'll continue doing our best with what we have.
Thanks, Leanne.
And if one other thing, sorry, I just want to add one other thing. I do meet regularly with my counterparts across the province at other municipalities, and we have had conversations about advocacy for additional funding for municipalities to implement this work. So that may also come to be.
And if I'll add again, we had those 2 slides of all our community partners who have been involved, and the synergy of our community is what makes us strong. And even though we might not have targeted funding, by working together and putting that synergy of all of us together, we are very creative in trying to address some of these issues as we move forward.
All right, thanks, Jeff and Leanne. Next question is, for those who might be interested in participating in the upcoming sessions, but aren't here this evening, can you outline briefly what the format of those sessions will be? And second to that, people want to help spread the word. So how can they help spread the word?
Fantastic. Thank you so much. Sorry, I missed the name of that individual.
It's Sean.
Okay, thanks so much, Sean. So it will be a virtual session, as you know. Carrie, you can register with Carrie. There is a poster going around over the next minute or two. I'll try to put that poster in the chat. Carrie, can I do that?
Yes.
if I can attach that. Okay, so I will do that. So the sessions will be an hour and a half in length. And Carrie and Jeff and I think Jeff will be there for some of them, if not all of them. But Carrie and I will be there for sure, and Jeff likely for all as well. And we have, for each session, we have 3 questions that we'll be posing to the participants. And then depending on how many people we have in each session, we may be using some breakout rooms to have smaller, more intimate conversations in the breakout rooms. We have some members of the Crime Prevention Council and the steering committee who have offered to attend the meetings and take some notes, so we can capture the feedback from the group. So it will be, at this point, the plan is 3 questions, and just to focus the conversation at each session.
And so
I hope that answers your question.
I've also just put the link where all of the information is on the Thunder Bay website. So the link is in the chat. You can pass that link on to anyone you want. And I'll also put the Facebook link into the chat in a moment.
Okay, that's fantastic. Thank you.
Yeah, and if I could just encourage people, as the chair of the committee, last year at this time, we were able to go out and reach people face to face. We were able to have those conversations. We were able to have the forums in person, and that, as difficult as even that is, virtual, I know, is tougher for people as well. And so if you're on the line with us tonight, or if you're hearing this after the fact, we really do encourage you to help people learn how to join these virtual forums. Some people may not still know how to use Zoom or how to register for online virtual forums. And if you can help people to spread that word, if you need assistance, reach out to Leanne, myself, and Carrie. We're more than happy to help people. We want to engage as many people as possible across our community into these sessions, because the more voices that we hear, the better community safety and well-being plan we can help develop for our community. So any assistance that you need from us, please reach out to us.
Yeah, absolutely. And thank you for raising that, Jeff. We worked really hard last time. We had our sessions last January to March. We held 25 different focus groups and forums, and we really reached out to the community. We had a lot of great input and feedback and involvement. And it's challenging this time around, knowing that we're not reaching or we aren't going to reach as many people. And so any help that you can provide is appreciated. We're not able to do paper copies as easily this time because of COVID. So our sessions are being held exclusively online, of course. So yeah, just to echo what Jeff said, if you can help in any way, get the word out. One really great way that you could potentially reach some other people to help us is, as Jeff mentioned, we've developed another community conversations guide. And so this is, I think it's 8 pages, and it includes some questions that you can pose in your own sort of mini consultation session. And so you can, set up your own Zoom meeting or maybe have a conversation with your family. And just pose a couple of questions that are in the guide, hand bomb some notes, and then we'll figure out a way to get that back to me. I'd be open to picking them up at your place of work or your home. You could drop them off to me. We can make those arrangements. But certainly we want to do our best to make this as accessible as possible to whoever wants to participate.
Yeah, Leanne and myself, we went out to meet with people, people that asked us to come and meet, and people that we thought we wanted to hear their voice, and we had not seen their voice come to the table yet as well. And so as we move forward here, if you have any voices that you think that we need to be hearing from, and you don't think that they're going to step forward, please reach out to us so that we can approach them. We can try to figure out how to hear people's voices in various ways and creative ways, and you know, as a community, we've been working hard during these COVID times, and it's really, really important that we hear from everyone, that everyone's voice is part of this community plan. So I really do want to encourage you to work with us. If you think there's something that we haven't thought about, feel free to reach out. We want to have that dialogue with you.
Absolutely. And one other thing I'll share is that, oh, you want to, I'm just seeing a note here. Rebecca, she would like to have the PowerPoint presentation. Absolutely. Carrie, are you able to send the PowerPoint out? Okay, that's great. Thank you for that, Councillor Johnson. One additional piece that I can offer is we have just completed or just finalized our phase 1 consultation report, which includes all of the information that you received tonight, but some additional information. We've just finalized that, and we're going to be posting that on the Facebook, or sorry, on the website tomorrow. It may be there now, but I haven't had a chance to check. It was just finalized today. So I invite you to also look at that report for some more information. I wanted to mention also the 24/7 virtual forum. So this is on the city's Get Involved public engagement platform. And we're working with our communications staff to get that up and running. Again, I've been in meetings all day. I apologize. I haven't confirmed that it's up, but if it's not up today, it'll be up tomorrow. And this will be an opportunity that's open 24 hours a day until we close the consultation process at 4:30 on March 26th. Which happens to be my birthday, so I'll be celebrating a few different things that day. And I encourage you also to go there. There will be an opportunity to connect in with with other people who are sharing messages about their thoughts and ideas around each of those priority areas. And so if you go to the city's website, to the Get Involved page, you'll be able to access that as well.
Leanne, there's another question here. Can we get a more specific breakdown on who has been consulted? It sounds like about 0.7% of the population responded in various ways in phase 1, and the diversity sounded good, but at 0.7% is a really low participation rate for such an important topic.
Yeah, I agree. And if you all just give me about 30 seconds, I will pull up the report and I will share with you all of the groups that participated. Okay.
Maybe
so these are the groups that, sorry, go ahead, Jeff.
Just where you were getting ready there, I was just going to address Kevin's questions. And thanks, Kevin, for the question. We really appreciate it. We obviously are the converted here, thinking that it's an important topic, without a doubt. And we utilize the media, we utilize the social media, the regular mainstream media. We try to talk as much as possible. We reach out to groups. Through phase 1, we encourage people to come to these events. We encourage people to, complete the online surveys. We try to make the survey online, virtual. We make it in paper form. We go out to events. You invite us, we come. If you want to do it yourself, we give you the skills and the tools to reach out to other groups. So without a doubt, as we did in phase 1, we are asking you as the community. The community is only as strong as those of us who participate. And absolutely, we are trying to give you all kinds of tools so that you can reach out to our friends, our neighbors, our colleagues in this community to get people to get involved. We can't force people to be involved. All we can do is communicate the message of how important this community safety plan is, and we give you the diversity of tools in order to be involved. So again, I know I've spoken about this a few times tonight, and as the chair of the committee, I really want to say, we have the tools for you. If you think that there's a tool that we're not providing, please, please, please let us know. And we're happy to work with you so that we do get more people's voices to this table.
Awesome. Thanks very much, Jeff. Okay, so I have a list of those organizations or groups that have participated. So we started January, January 15th, the first forum we had with the members of the Crime Prevention Council just to test it out. Then we had a session with the Urban Aboriginal Advisory Committee. So this is a committee, they had representation from the Ontario Native Women's Association, the Thunder Bay Indigenous Friendship Center. They had Indigenous youth at the table. Let's see, then we had a public forum. We had 90 members from the community participate in that. We had a public forum for service providers. We had 86 service providers participate there. We had a focus group with the Center of Responsibility for the Northwest region. And this is a group that looks at different justice related issues and health issues in Northwestern Ontario. And they are sort of a systems level planning table that does more systems level planning around issues in the community. And they're affiliated with the Thunder Bay Situation Table. We had a focus group with PACE, or People Advocating for Change and Empowerment, and they're located on Victoria Ave. Yeah. We had a session with the Thunder Bay Public Library, so we had staff from 3 different library sites participate in that. We had a session with the staff from Matawa First Nations Management, so we had 65 staff participate in that session. We held a session with residents at the shelter house, clients there rather. Another session with the Accessibility Advisory Committee. We had 2 sessions with different at ward meetings. So the Red River ward meeting with Councillor McKinnon, and one with Councillor Kristen Oliver for Westfort. We did a session with Elevate, a session with the Muslim community and the mosque. We did a session with the 7 Youth Inquest partners. So that included NAN, Matawa, DFC, Shibogama, Kiwetanuk, Okimakanak. We also had session with some newcomers through the Multicultural Association, also people with lived experience. There's an advisory committee that is coordinated through PACE and the Thunder Bay Drug Strategy. So we met with that group. We met with the Thunder Bay District Coordinating Committee to End Women Abuse. We held a youth forum with Lakehead Public Schools where we had 40 youth from grades 9 to 12 participate. We held a session with youth from Westgate, a session with youth at the Canada Games Complex. I'm almost there. We held a seniors forum where we had 68 seniors participate. And then we had a couple of community conversations, one being with the Lakehead Unitarian Fellowship and one coming from the Thunder Bay Museum. So in total, 779 people were engaged. And while I do agree that that isn't a large proportion of the community, I think that it's a good representation of diverse groups in our community. Yeah. So any more questions about anything there? Great, thanks for your comment, Kevin. The challenge this time around is well, one of the many challenges, I guess, is that a lot of the groups that we'd like to connect with just can't make themselves available. They are full on responding to the COVID emergency. And that's really in part why we weren't able to do much work on this in 2020, as we were pulled off to help with the COVID response. So while I'm really happy to get back to this, that's always sort of on my mind as well. And, just hoping for the best for everyone in our community.
Leanne, there's another question from Rose. She says, thank you for the presentation and all the work completed so far. I'm wondering, once the plan is completed, who or what entity is ultimately accountable to carry it out?
It's a great question. Thank you for that, Rose. So the way that it is set up right now, the province puts that responsibility on the municipality to oversee that plan. So the Crime Prevention Council, as Jeff mentioned at the beginning of the evening or of our session, the Crime Prevention Council was appointed by City Council to oversee the development of this plan. So while it will be the ultimate responsibility of the municipality, we do have very strong partnerships within our membership. And so it will really be a collective effort, of course, but ultimately it will be the responsibility of the city. And so, for example, if the city did not do this plan, the province would appoint someone to come in and do the plan for us. So we are certainly keen to do this plan for our community. And yeah, ultimately we will be responsible.
And again, I'll speak as the chair of the Crime Prevention Council. We are an advisory council to City Council. You can be sure that this plan will be on our radar, right in front of us, and we will be holding council accountable as much as we can under the advisory capacities that we have.
Mm-hmm. Yeah, absolutely. And this plan will replace the Crime Prevention Council's strategic plan. Our previous plan was developed in 2017 and ran 2017 to 2020. So this fell very much in line with our planning timelines. We would be doing another community safety and wellbeing plan now, or a strategic plan now anyways. And so this is given what the province is expecting from this kind of a plan, this is a really good fit for the Crime Prevention Council. And so we're happy to certainly to take on this work. Are there any other questions? Please don't be shy.
There's a question from Ian. Advocacy was mentioned. How serious are we going to be?
Thank you, Ian, for your question. So we are very serious about advocacy. And so I can tell you, since I've been in the role of the coordinator for the Crime Prevention Council, we have brought a number of issues to the city's intergovernmental organization. Let me see, the Intergovernmental Advisory Committee. And then they bring that forward to different ministers and different ministries to advocate on our behalf. So we have asked for a number of things over the years. We have pushed for funding for some different programs, and we have been successful for some of those, for sure. I really do believe that advocacy has shone a light where we really need to have a light shone, and so that the gaps that have long been impacting, let's say, safety and quality of life for a lot of people, not just in our community, but across the country and really around the world. I'm really hoping that the funding that is being put into place now to support populations that are made vulnerable by these gaps, I'm really hoping that they will stay. Those funds will continue to flow. I mean, yeah, there's a lot of work to do. And we thank you, Councillor Johnson, Intergovernmental Affairs Committee. Thank you very much. There is a lot of work to do. And in fact, we brought a report to City Council last night, and we had some of those conversations, just the need to do really strong advocacy to other orders of government, because as we know, the municipality doesn't have ultimate responsibility for some of the issues that we are seeing in our community, but we do have to work together and do the best that we can at our level, at the municipal level, to support everyone in our community.
Again, I'll speak on behalf of the Crime Prevention Council. That, Ian, thank you for the question. The Crime Prevention Council sees themselves as a strong advocacy group. Our 45 members, which are made up of organizations and individuals, is a good cross section of the community, and they bring issues to our table, and the Crime Prevention Council then is able to take those issues forward to City Council. We are honored at Crime Prevention Council to have members of City Council sit at our table, including the mayor and the mayor's office. So when we are talking about issues, when we are advocating ideas at the Crime Prevention Council table, we are honored to have council members sitting there who are hearing these discussions being talked about right at the table, right at the grassroots level. We do get the opportunity to go to City Council with items, and as Leanne mentioned, we were there last night presenting on where we are with regards to this phase. So advocacy, absolutely a high priority to us. We want to advocate for all of this, our citizens in the community with regards to community safety and well-being, and we will continue to do so in order that we can address the issues that we're trying to address here.
Yeah, absolutely. Jeff, thank you for that. And again, thanks for the question, Ian. You know, I will say, when you look at the priority areas that have been identified, there are a lot of structural and systemic issues that underlie those priorities. And so certainly we will be advocating for change at the highest level.
Are there any other questions?
Maybe we'll just leave it open for another minute or so. If anyone else has any questions, here's your chance. I will also say, you know, I am very open to receiving phone calls and emails. Should anyone have any direct questions for me, I'm happy to take calls at any time. And my number is, I'll put it in the chat here. I'll put my email in the chat, and I'll also put my my phone number should anyone wish to contact me directly. All right, there you have it. All right, any other questions?
I just want to say I look forward to seeing everyone coming up at the sessions upcoming, and please invite your neighbors, invite your friends, reach out to everyone. The more voices we have at these tables, as I've said earlier, the better we can develop a plan and then put it into action.
Yeah, absolutely. Okay. Well, I see some people are starting to duck out, and I don't see any more questions coming through. So I think we will sign off. I want to thank Carrie for coordinating, and Jeff for all of his work with the committee. Thank you all so much. I really appreciate your time this evening, and we'll look forward to seeing you over the next couple of weeks at some other sessions. So bring your questions, and we'll look forward to having those conversations. Thank you all so much, and have
Leanne?
a good. Oh,
Leanne,
yes.
can you hear me?